welcome to Unleash Inner Goldilocks, how to get it just right. Thank you so much for joining us for another interesting and insightful conversation to help us move from where we are to where we need to get to in a way that is going to be just right for us. With all the disruptions going on around us, one of the most important things most of us tend to forget is to pause and take a look at what's going on within ourselves in our life and focus on our well-being so that we can be present and functional to take on and deal with the disruption. And to have this conversation with me is an amazing friend of the Goldilocks community, Dr. Nandini Menon. Dr. Nandini, welcome to Unleash Inner Goldilocks.
Thank you. Lovely to be here. Appreciate being on this every week and supporting you in this. Thank you.
Thank you so much, Dr. Menon. So as we get started, what are you seeing in your profession, in your community, as people are suffering through various public policy, financial, work disruption? All of these things have a physiological and psychological impact. What is the medical community seeing and understanding in terms of what's going on?
So I am in ophthalmology, so I'm a little bit more removed from the main medical field. And, you know, when I go to the meetings with my local other physicians, I think we're very concerned about access to care and people dropping off their regular visits, you know, compensating for medical health because they need for food and for other vital necessities. You know, I was reading an article today that even with a six-figure salary, if you earn $100,000 today, you know, 5 years ago versus today, you should be earning like 170 to be able to live the same lifestyle. And there's a percentage of people, even with $100,000, that are giving up certain medical cares, certain essential health and well-being things to provide for families, for their kids, you know, for meals and things, and they themselves are skipping meals. And you'd think $100,000 is a lot of money.
Mm-hmm.
But with insurance premiums going up, with copays going up, you know, we're anticipating a lot of people not being able to come to see the doctor because they don't want to pay the 75 or the 50 or the 120 out of pocket to do what is necessary for them.
So now that is going to have a cascading effect because if they can't go and take care of things preventatively or early on, then they're going to end up in the emergency room for catastrophic situations.
Yes. You know, and it's going to build up, you know, and so that's what we're concerned about. And also, like, you know, there's a lot of advocacy, like we're doing, you know, we're trying to, a lot of organizations of physicians are trying to approach advocacy like right at medical school level, because when we grew up in medicine, you know, all we thought about was, okay, we're going to become doctors, we're going to treat patients, we're going to save the world, and that's it. Mm-hmm. You know, we don't think about the business side of medicine, the emotional intelligence side of medicine, the patient impact, you know, and advocacy for ourselves, for our patients. That's not part of our purview because we assume society is going to take care of that because we're going to take care of society and that we're exempt from those things. And unfortunately, now we've come to a point where as physicians, you know, all the physician organizations are noticing like, okay, like if we don't talk about these things, nobody's going to talk about it. And this is why we've reached to this point, you know. And so I think there's a lot of generation of advocacy groups and things like that where physicians are trying to teach or inform younger physicians to start advocating for themselves, for their patients, for whatever it is they're passionate about, in their lives, like right from the get-go, like year 1, year 2 of medical school, and I think that's important, because when we learn to balance all parts of our lives right at the beginning, then hopefully as those physicians mature, they have a better understanding of how to manage the patient care, keeping up with medicine itself, for excellence in care of patients, and keeping up with our families, and keeping up with the advocacy that we need to do outside of work. And so learning to balance that, which we never had that opportunity to figure out. We're doing it on the fly, We're trying to find the time for these things.
Yeah. So it's an interesting point you bring up, Nandini, because ultimately education in any field has been so focused on the technical. Because the notion has been business will do the right thing, government will shape the public policy to take care of its people.
Yes.
And professionals just have to go and fulfill their professional responsibility using their professional skills.
Yes.
But as government stops serving people and the community, because that's the purpose of the government itself, right, to serve its people.
Right.
And businesses are focused on profits and not necessarily governance. All of this is falling on professionals.
Yes.
So the question that's coming up for me, and this is what I see everybody dealing with, is the life of a professional is becoming untenable. All of those pressures are on them. And if you care too much, you can lose yourself. And in order not to lose yourself, you just put a blanket on and you say, this is just a job. And where does that allow people to move? Because there's always that guilt if you care, right?
Right. Yes.
So all of the psychological things have a physiological impact too. Stress, burnout, all of that.
Yes. Yes, I do agree with you on that. And I'm glad you brought up that point, because there was just a couple of weeks ago, somebody was asking me, because I was, there's always new drugs that come up on the market, and people come to let us know, the drug salespeople come to let us know. And I looked through it and I thought it was, a decent thing for certain group of my patients. And so I kind of started talking about it to the patients, and I gave a few prescriptions out. So the drug rep came back to me and said, Dr. Menon, you're doing this, and I'm having I'm wondering what is different about you versus the other medicals, because the optometrists are giving the prescriptions, but the MDs are not. And you're one of my few MDs that do, and I want to know what your mindset is. And I told her, I said, the pandemic taught me something. It taught me, I don't want to say not to care too much, because I still care about the well-being of my patients. But with that whole thing about, masking and vaccines, and, for me, the logic of science was just so obvious that I could not fathom somebody having a different point of view. It's like a parent teaching a child and the child not wanting to go to school or do their homework, and you're like stomping and forcing, and they're not doing it, and you're just pushing them further away. And the one thing I realized, like through self connection and self-awareness and emotional, doing the deeper work, because I was going into burnout, I realized, okay, they're individuals too. They have ideas too. And I'm vested in my patient's care, but I'm not personalizing it anymore. So I still care, but there's a difference in the care where I stand apart, and I mourn and I long for my patients to understand where I'm coming from and to trust me and to respect my opinion, but I don't base my identity on it anymore. And I think that's the difference, where I give patients choices and I just let them decide. Because if you think you're adult enough not to wear a mask and not to get vaccinated. You're adult enough to decide what you can and cannot do. And if you want to do that, that's on you, not on me anymore. So that has helped me with my personal space. And it has changed the way I treat my patients, and I practice my knowledge of medicine. Did that answer your question?
Absolutely. So I find that so insightful. So the way my brain is translating,
Uh-huh.
when I come from a culture that looks at life very differently, right?
Yes.
As souls, we are connected to one another, but we can still be detached without being attached, because attachment comes from ego.
Yes.
So I am the professional. You need to listen to me. You don't know what you're doing, because it's an I thou relationship in an attachment.
Correct. Yes.
But getting back to the roots of having the soul connection and caring about the trajectory of what that journey is going to be, but at the same time, not getting attached to be upset about the choices that soul makes.
Yes. Correct. Yes, and that is correct. And that is what the journey for me has been. I've I've all along been a very passionate, emotional person. And so, when somebody says something or does something, it used to affect me internally. And doing all this, and that is one thing that the pandemic has given me. It's given me that pause to like rethink and understand and reevaluate the ego. And there's this version of, relationships where, you have power with, power over, power under. And all of us have those. And if we look at our relationships with that, and we try to consciously develop power with relationships, and it even with our children, or our parents, or our spouses, when we want somebody to make the bed a certain way and only that way, and when they don't do it that way, you get upset and you do it yourself. Just thinking about that power dynamic of like, is this a power with, power under, power over, and how do I achieve this? We talk about equality, equity, and all of these things, but we live our lives with this.
Yeah.
And how do we get here? And that's what the standing away and being able to look at life objectively and reconnect, with my feelings and what the impact of my actions and words have on myself, on others, on the world, gives you that kind of more wholesome outlook.
So that is such a brilliant perspective, because reality is we can only manage us, control ourselves, and change ourselves. We can't make anybody else do anything else, right? So when we come from that place, and we'll pivot from the physician to the patient, so like everyday individuals,
Right.
what can they do in this disruptive world to prioritize them? Because it's not just not having money to go to the doctor. It's about, do they have the money to eat the right kind of food, take the right kind of care, so that what we are consuming is not consuming us and making us patients, right? Stress is one, and life circumstances are another. But being able to make the right choices, and the fact that everything organic should be cheaper because it's natural. And yet in this world, everything organic is more expensive. I don't understand that.
Yeah.
And so to eat healthy is more expensive. What could we as individuals do to figure out what our priorities should be in our wellness itself?
Right. And so, again, it goes back down to advocacy, right? Advocating for yourself. And when you have groups, who can advocate for themselves, that creates power between us. And so, again, going back to creating organizations, finding the same like-minded individuals, getting together, and creating that power, and changing legislation, and that's what I tell patients now when they get mad at me for, oh my God, I can't afford this drug, you're, this and that. And I'm like, well, we're in this together. I have frustrations about this too. And I'm glad you have frustrations about it too. Maybe, we can work together, or, there are other ways we can do this. And it is legislation. And we're the ones that put these people in power. We're the ones that created this, where we are today. Whether we did something or we didn't do something, whether we said something and people misunderstood it, that is all the impact. And that's why I said whatever action we have, we say, or we do, we have impact on ourselves, on our immediate family and friends, and the environment, and our future, and our planet, and other people. And so if we can look at those impacts, that everything we do and we can work together on it, that is a wonderful way to go. And where I see it happening is, I've started learning to speak in a more responsible way. I'm learning, and I think I've told you this, I'm learning nonviolent communication, which is like compassionate communication. And it's based on the Gandhian philosophy of Ahimsa, where when you hear nonviolence, you think, physical violence, but it's actually do no harm, right? Ahimsa, absence of harm, which is thoughts, words, and action to others. And the first step to it is to ourselves.
Absolutely.
So that's where I am. And I'm trying to just, create a small space where self-compassion, generates that energy so that we can be more compassionate with ourselves, and just hearing my patients and listening to them and being able to reflect back to them in these times, gives them that moment of calmness that maybe they can find solutions that you can't see.
Mm-hmm. That is very, very thoughtful and thought-provoking. So thank you. Thank you for sharing that. And yes, the word ahimsa doesn't have a direct English word. You have to have so many different ways to explain it.
Yes.
But I am glad you brought that up. Now, as you move from that perspective and what you need to do and have compassion for yourself and stay connected to everything around you, right? Starting from within.
Mm-hmm.
What else can people do? Because what I'm thinking is we're not just a person who can be a patient, right? We're a consumer, we're a citizen who vote. So we do shape the life that meets us.
Yes.
So as medical professionals and a community of health and wellness minded individuals, whether you're the patient, you're the care provider, or part of the care providing system, what can we do differently? Because we didn't get here accidentally. Correct. This has been a slow, steady walk. And we're just going to be falling off the cliff very soon here.
Yes. Yes. And again, it goes back to just listening to the other side. And I think we've stopped talking to each other, really connecting, what my needs are and what your needs are, because they're all basically the same universal human needs. We all want security, food security, financial security. We all want personal and community safety. We all want shelter, water, clean air. And if we look at those things and we sit down and we go down to the basic needs that all of us as individuals want and desire, there is no conflict. Yeah. It's the strategies we choose that create the conflict, right? And so being able to educate people that, this is one way of doing things, but let's focus on what we actually want to achieve. What we want to achieve is good housing or, good food, like what you said, organic food, cheaper, right? How do we achieve that? One way is to do legislation. The other way is to perhaps flood the market. Isn't that what it is? If we flood the market, the law of of finances or economics says if you flood the market with something, the price goes down because there's more, right? And it's the same thing with the insurance. The reason, like what you were saying, consumerism has got us here is because the more you can produce of something, the cheaper it is, right? And so even with insurance, the reason healthcare with insurance is cheaper or used to be cheaper than individuals without insurance, it's because groups of people have insurance so they can get a better rate. And the idea is that more people will be coming to me so I can give them a discount. And so the person without insurance ends up having healthcare that's much higher. And this is changing, especially in ophthalmology, because our reimbursements are getting lower and lower and lower. A lot of us in ophthalmology are starting to look outside the box. And it's funny because medicine might be moving back to the way it used to be, where, you come in, you pay me something, and I treat you. And a lot of providers are actually contemplating going out of insurance and saying, we're not accepting any insurance. This is a standard price. You pay us this much, we'll do X, Y, and Z. It's changing the way we bill. It's changing the way we do a lot of things because we're reaching an impasse as well. And we want to provide good healthcare.
Totally hear you. I want to pivot to a question that has always nagged me. All medical research are done on men because doing research on women, their hormonal cycle, their pregnancies, their menopause, the notion is that creates so much noise, we can't study women. So everything is studied on men, and what works for men is being done to women, and it doesn't work.
Right. Yeah.
Because if you have night vision glasses, you can't wear that and go out in the sun, right? Whatever is meant for a purpose has to be meant for a purpose. What is it going to take for us as a society to prioritize women? Because women give birth, so they create life, they nurture life, they protect life, and they take care of everybody throughout their whole lifespan, right? And if that woman's health is not prioritized based on how her body functions, then what's the purpose of medicine? So not only the research is not done on women, then legislature also prevents women from prioritizing their bodies and the choices about their bodies.
Right. I think this is changing, the fact that, there are more women in research. There are more women subjects in research as well, because, we're more out there now and with the internet and a lot more information. And the fact that there's more women in medical schools than men now. I remember when I was in residency, one of my senior, really, he was about to retire. He told me, there's more women going into medicine now than men, and they're just being stupid because they don't see that medicine is not the way you make money anymore. There's so many other ways. And that's why men are going into finance and women are now starting to go into medicine because they're stupid. And I was a little resident at that time, newly minted into America. And I was just listening very quietly thinking, oh my God, I have to spend an hour and a half in this car with this man till I get to clinic, because we were doing an outreach. And your question comes down to that, the more women go into a field, the more women are in the field, the more women's are there to advocate. A lot more women are starting private practices now. So the way we change, the way we treat, the way we run, the way we we're changing the culture of medicine because our priorities are different. Mm-hmm. Our values are different. We don't look at, okay, we're not going into medicine for, okay, we're going to make the big bucks, but we're going in there saying, yes, we want enough to take care of our family, but we also want time. We also want to spend with our kids. We want our staff to have time, because if our kids are important, so is theirs. And medicine is a field with a lot of women working as nursing aides, nurses, allied health is mostly women, right? Mm-hmm. And so with women being in research positions, becoming heads of departments, becoming more professors in these fields, a lot more women are doing research on women's health, women's women problems, so to speak. And so I think this is changing. I think it's just a natural cycle of life, just like with you, I think there's a culture of where in corporate world, because more women are in the C-suite, now like there are meetings being held in spas at 5 o'clock instead of 10 o'clock in the cigar room. I mean, everything's changing, and it's because women are going into fields and we're changing the way we do business, the way we do medicine, the way we do research. So I think I don't think you need to worry about that. I think it is happening as just part of the way life is now.
Thank you. Thank you for that reassurance. I would love to open this up for questions from our audience, but before we do that, Nandini, could you tell our audience how they can get a hold of Dr. Menon if they want to have a conversation? Other medical professionals who want to talk to you about the importance of nonviolence communication in healthcare.
Thank you. Sure. I am actually easiest to find on LinkedIn. I am on Facebook and Instagram and all this stuff, but I'm not a big social media person. So the one I check on most is LinkedIn. And so that would be the easiest way to contact me. And I am an ophthalmologist in Louisville, Kentucky. So there's always that. Yes.
Thank you. Thank you, Dr. Menon. Go ahead, Robin.
This has been a wonderful conversation. And I'm wondering if you can describe when you kind of shifted a bit your focus and how you're interacting with your clients and shifting just what you've described during this conversation. Did you notice a change in how your patients respond to you and just the atmosphere or culture of your own office and practice?
Thank you, Robin. I always look forward to your very insightful questions during this podcast. Yes, I have noticed a shift. I have noticed a deeper connection, with my patients and with my staff, where I am able to observe their personalities and where they are in their lives, and be able to adjust my clinic appropriately. Like, for example, just yesterday, I was giving myself a win because of my self-awareness. I have a assistant who has really bad menstrual issues. Okay. And so she's my scribe. And so, she's the person that's working closest with me yesterday. And she was not having a great day, because of those things. And I remember my previous self would have been like, oh my God, just put your big old panties on, just move on, And instead I was noticing that I was so much more compassionate, because my mind was not focused on just my patient and being efficient and good at my job. It was also focused on the whole of my clinic, And so I took a step back and I was like, you know what, let me just do this part and do this and do that. And I just adjusted my own expectations for myself. I took accountability for my own clinic, and eased the stress or the perceived stress that she had, that she was responsible for certain things, and that just brought everything down, and everybody was so much calmer. And maybe they weren't, but I was so much calmer, and I found that imbibing into the rest of the day, because then I was not rushing. I was fast, but efficient, but not rushing, and this is a concept that a lot of people forget. There's a difference of being rushed versus efficient and fast. And so finding that, and it's stress, right? Just managing your mental switch, because it is basically a program. You can either go on and not stop to just take a breath. And if you just take a breath and bring that stress level down and recognize that you have the power to change the emotional aura around you, that in itself changes the whole day. So
what a brilliant conversation. Thank you so much, Robin, for that insightful question. And Dr. Menon, this has been an absolute delight at a very relevant time. So appreciate you making the time.
thank
And
you.
to our audience out there, go back and listen to this if you need to, bookmark and again, because the insights here are going to help shape not just your well-being, but how you show up in your profession, how you show up in a connected way, and how we each get to choose compassion and efficiency. And as we choose those, and we take deep breaths and pause in order to do that, our own physiology and psychology will get to an equilibrium that is going to be more serving to us. So embrace a calmer, connected world. And the trick here is to learning to let go of the ego and being present. And as you go on with your day-to-day and your professional world, focus on your well-being. Focus on that compassion starting from inside and cascading out towards everything around you.